Hi, this is Stasha-Gae Roberts, nurse practitioner and owner of Compassion Primary Care. Thank you for taking the time to watch this video. Just a reminder, Compassion Primary Care is an integrative practice treating individuals 18 years and older in the Brandon and Tampa area. At Compassion Primary Care, we treat you like a person, not a number. Patients are seen virtually or in the comfort of their own homes. Today, I will be discussing small intestinal bacterial overgrowth, also known as SIBO. SIBO is defined as an increase in bacteria in the small intestine above normal values. Normally, we should not really have much bacteria in our small intestines. The increased presence of this bacteria leads to fermentation of food, excessive gas, and symptoms such as flatulence, bloating, pain in the abdominal area, nausea, dyspepsia, malabsorption, malnutrition, weight loss, fatigue, joint pain, constipation, and diarrhea. That's a lot. The causes of SIBO are complex and multifactorial. Changes or abnormalities in gastric motility, anatomy, immune function, hypochlorhydria, metabolic and systemic disorders can lead to SIBO. Changes in host defense mechanisms, such as decreased hydrochloric acid, which is often seen when patients take proton pump inhibitors long-term, decrease in bile acid secretion due to gallstones or the removal of the gallbladder, or decreases in proteolytic enzymes, which can be seen with acute or chronic pancreatitis, all compromise the gastrointestinal system and increase the risk of SIBO. An impaired ileocecal valve can lead to colon bacteria actually migrating into the small intestine ileum, increasing the risk of SIBO. Abnormalities of the GI tract that delay the emptying of the bowels, such as small intestinal diverticulosis, bowel strictures, postoperative adhesions, gastric bypasses with blind intestinal loops, and ileocecal resection can lead to development of SIBO. Compromise in secretory immunoglobulin IgA, which helps to maintain the integrity of the digestive tract and prevents pathogens and toxins from invading the systemic circulation, can increase the risk of this disorder. SIBO can cause deficiencies in macro and micronutrients. For example, the inability to absorb fats can lead to weight loss, diarrhea, and deficiencies of vitamins A and D. Abdominal distension, which can be caused by methane and hydrogen gas, excess flatus, and acidic stool, can be due to carbohydrate malabsorption. Decrease in mucosal uptake can lead to protein malabsorption. Deficiencies in B vitamins such as B12, thiamine, and nicotinamide are also often noted. Increases in vitamin K and folate can be seen. Diets that are high in processed carbohydrates, alcohol, and sugar increase the risk of developing SIBO. It is difficult to determine how many people are actually affected by SIBO because it is similar to other gastrointestinal ailments such as celiac disease, lactose or sucrose intolerance, fructose malabsorption, irritable bowel syndrome or IBS, and inflammatory bowel disorders, which includes Crohn's disease and ulcerative colitis. SIBO is more prevalent in women and older adults. There is actually a high correlation between IBS and SIBO. Some believe that over 50 to 80% of those diagnosed with IBS can be attributed to small intestinal bacterial overgrowth. IBS is a chronic bowel disorder associated with recurrent abdominal pain for at least 1 day during the week over the past 3 months. It is also associated with changes in stool form and frequency. So people either have IBS constipation, IBS diarrhea, or a combination of the two. Bloating, constipation, diarrhea, and incontinence are common symptoms experienced by patients who are diagnosed with IBS. In addition, stress and anxiety are often associated with this disorder. Again, women are often more affected by IBS, and people younger than the age of 40 are more likely to be diagnosed with IBS. Unfortunately, there are no diagnostic tests available to prove that you have IBS. Although IBS is diagnosed based on clinical symptoms, SIBO is actually diagnosed either by a breath test or by obtaining an aspirate of fluid from the small intestine. The small intestinal aspirate is the gold standard. However, it is invasive, expensive, it requires a skilled gastroenterologist, and sampling errors can occur. A breath test can detect microbial overgrowth in the small intestines. Hydrogen or methane are produced by bacteria in the small intestines and exhaled on the breath. Excessive levels of hydrogen, methane, or hydrogen sulfide gas can be measured with a breath test. Compassion Primary Care has partnered with AllClear, a CLIA-certified lab company that supplies at-home breath kits to diagnose SIBO. Home testing provides an easier way for patients to be diagnosed and start treatment for SIBO. Antibiotics such as rifaximin may or may not be combined with neomycin and metronidazole, which are antibiotics as well, for at least 2 weeks to treat SIBO. However, integrative or functional medicine approaches SIBO a little bit more holistically. Those antibiotics can be used, but in addition to that, usually there's a recommendation to change the diet. The most common diets used for SIBO are low FODMAP diet. FODMAP means fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, or the elemental diet. Different herbal antimicrobials can also be used, usually at least 2 of them, to treat SIBO. They include oregano, berberine, allicin, or neem. A diagnosis of SIBO is often delayed and, if not treated appropriately, can have high rate of reoccurrence. As discussed here today, many people are suffering with undiagnosed SIBO. Several health conditions are associated with SIBO. In addition to irritable bowel syndrome, which we talked about earlier, diabetes, autoimmune arthritis, rosacea, interstitial cystitis, restless leg syndrome, hypothyroidism, and fortunately more diseases are associated with SIBO. Medications, again, including proton pump inhibitors, PPIs, narcotics, and antibiotics, can increase the possibility of developing SIBO. Left untreated, SIBO can lead to severe health conditions, and these include osteoporosis, anemia, and kidney stones. So why continue to suffer? If you have been dealing with symptoms related to SIBO, call Compassion Primary Care to set up an appointment, complete an evaluation, and an affordable in-home test. Today can be the beginning of your recovery. Call or text us at 813-669-3084. Again, thank you for watching. Please like, share, and subscribe. I am Stasha-Gae Roberts, nurse practitioner and owner of Compassion Primary Care. Thank you. Bye-bye.